Hello, everyone. I'm Kelly Kraft, Program Manager at Gilda's Club Quad Cities, and you've tuned in for Feel More Like You. Just a little bit about what Gilda's Club does. We're a cancer support community that provides 100% free psychosocial support to anyone impacted by cancer. So that's anyone with an active diagnosis, survivors, friends and family, and kids. We offer support groups, educational workshops like this one, healthy lifestyle activities, so like yoga and meditation, social events, and kids and teens programs. We'll get started with our presentation. If anyone on Facebook has any questions or comments, comment them in on the live feed and we'll get them over to our presenters. And I am excited to be live with Walgreens Pharmacist Tom and beauty area expert Greta. So I'll let Greta take it away.
Hi, everyone. My name is Greta Kukay. I am the beauty area expert for not only the Quad Cities, but I also cover a large part of Illinois and part of Missouri too. So I work with all of our beauty consultants to make sure that they have training to help any individuals that are coming in for skincare, cosmetics, hair care, body products. We do a lot of continuing education with them. And I'm really excited to talk about the Feel More Like You program with everyone tonight. So I'm going to go ahead and share my screen here. All right, let me get this in. Okay, is that looking good on your end over there?
Looks good over here.
All right, perfect. So with the Feel More Like You service, this is, I'm really excited to talk about it because so many people have found that when you have support and guidance to address both the internal and outside changes that are making you feel like a stranger, it can give you a physical and mental boost and help you define how you're going to face treatment instead of it defining you. So I'm going to show the video. This was the commercial that we had when we first launched this service. And I think it's really empowering. So let me go ahead and press play here. Big bold woman gonna come and applaud. Got my back woman, I do applaud. She a queen, and you know she never lean. They be waiting for a stumble, but she never trip again.
Walgreens, battle beautifully.
All right. So let me get right back into my. Okay, so with the Feel More Like You service, based on all of our planning and research, we developed this as a team approach with our specially trained pharmacists and beauty consultants that are leading the way to support people that are experiencing both the internal and the visible cancer treatment side effects. So to make it convenient and accessible as possible, we made this service free of charge with no appointment necessary. And here you can see that we have 12,000 trained pharmacists and 3,000 trained beauty consultants in our 3,000 participating locations. So, since the launch of this service in 2019, that was the official nationwide launch, we have done, I think last year in March, it was around 20,000 consultations. And so at this point, I'm sure we have at least doubled that. And since not all of our locations have beauty consultants, only select locations have our trained beauty consultants in them. To find a participating location near you, you can visit walgreens.com/ Feel More Like You. And I'll talk a little bit more about that at the end here. Sorry, it keeps kicking me out of my my mode here because I have a few other little things here on the side of my screen. So yeah, it's cool that we have this in so many of our locations. It would be great if we had them in each store, but we're happy to have this service that is available in most areas. And I also gave a list of our stores that would be probably closest in the Quad Cities. So if you do have any questions, we can always help find a store for you ourselves. And this is just really kind of talking about how our beauty consultants in these select locations that I've been talking about have received extensive specialized training to help people with a variety of visible changes that they're seeing, like hair loss, dry hair, dry skin and skin discolorations, sun protection, which is very critical, and then any changes to the nails and cuticles. And our pharmacists in those select locations also went through specialized training to provide additional knowledge about a range of internal side effects and how to guide people in managing them. So the pharmacist can recommend appropriate over-the-counter products, and they can work with the person's doctor or wider healthcare team, if necessary, on certain side effects. So as a team, these beauty consultants and pharmacists can give people the help needed to feel better all over. And now I will pass it over to our specialty pharmacist, Tom Truong, who will discuss some of the tips on working with your specialty pharmacy team. So Tom, I will pass it over to you.
Awesome. Thanks, Greta. So yeah, my name is Tom Truong. I am the pharmacist and pharmacy manager at what we call Community, a Walgreens pharmacy in Iowa City. We have 2 community sites in the state of Iowa, one in Des Moines, which opened about 4 or 5 years ago, and I'm a little bit newer. We opened about a year and a half ago. So we call these community sites because we are really interactive with the community. So I serve basically all of Eastern Iowa in helping patients in offices get through barriers, which I'll talk about here. So really the differences between what a retail pharmacy and a specialty pharmacy like mine is that we're really set up like an office with a pharmacy attached to it. We are proactive in helping patients rather than putting the burden on you and having you be responsible for your refill and your side effects. We're proactive in reaching out to you to make sure you're filling your medication, which is important to take, every single day or every week or every month. So we're reaching out to you to make sure there's no issues with taking the medication. There's no issues with side effects with the medications. And if those things happen or do occur, we coordinate those communications with your provider's office. And usually we have really great relationships and dynamics. We really hit that trifecta between patient, pharmacist, and office communication. So thanks, Greta. So yeah, so as far as prior authorization and financial assistance and drug access, specialty pharmacy works in a little bit a different capacity than what you think of as a retail store would. We are really ingrained with the process from start to finish. So I like to think of the story as, once you find out your diagnosis or once you find out what your disease state happens to be, from there's a lot of anxiety and a lot of emotions that run into it. So we're there to help you get through the insurance portion and the financial portion of it. And then making sure you can get access to the therapy as quickly as possible. These medications aren't cheap. I think we all know that, and healthcare is a system that we're always trying to work on and try to figure out. But my job and our partner in Des Moines, Steven, the pharmacist and pharmacy manager there, I think we do a really great job of trying to find the best support and foundational assistance for our patients. Because not anyone can really afford thousands of dollars a month. So I think it's really important to story tell that part, is that we're there from the beginning of at least the prescription journey for you. So um, So in terms of coordination of care, we really work, like I said, with your providers on making sure you're not feeling any adverse effects. If you are feeling any adverse effects, this is something that we're going to reach out back to your doctor so that they can document this. If they deem it important enough, they'll reach out to you so that no one's really left in the dark. Again, we're proactive in reaching out to you and counseling for you and making sure that you don't have any questions. Our team is set up to be consistent. So I'm there. Steven's there every Monday through Friday. I have a staff pharmacist, Jen. We have 2 and 3 technicians that are there consistently Monday through Friday. So when you call, you know who you're talking to. There's only, the one of 5 that work there consistently. So we're absolutely there to help. So really, in the short time, it's difficult to say all the things we do, and I think Gay can reach on this too. Gay is one of our partners, and Greta as well. But just think of us as a partner in the healthcare team that you work with. Again, from the diagnosis to the prescription portion, to when you finish taking your last dose. So please keep us in mind when you're in need of anything, honestly, from financial assistance, like I said, to authorization through the insurance, or finding any sort of assistance through the manufacturer. Those are things that we always help with. So. And really just want to spend a minute or two here on, and Greta had already alluded to this, but talking about the side effects with hair, skin, nails, and mouth. When we think about these things, it's when you're taking medications that are essentially hazardous to your body, but essential to your cure. These medications are going to affect things that have what we call high cellular turnover. So hair, skin, nails, mouth, those are all things that have high skin or high cellular turnover. So those are the things that are going to be most affected. Starting with your hair, I think most people think of when they start therapy or start medication, their hair falls out, their skin gets itchy and plaquey, and their nails start to get brittle and fall off, and some patients have mouth ulcers. Greta, we can move on to the next slide here. And then just to hit on a couple of the things for management of those, just a quick slide. And I'm sure this information will be sent or at least recorded for people who are reviewing. But these are just a couple of the recommendations that we can or would make in consultation with your provider. And also, again, alluding to Greta with working with the beauty advisors. There's a great dynamic between the beauty advisors in the store and the pharmacists that work together for you. So.
All right. Thank you so much, Tom. Appreciate it.
Yeah.
And with what Tom just shared, and the skin changing so much during treatment and with a lot of different medications, we are going to go ahead and just dive right into skincare, since that is one of the topics that I know I personally get a ton of questions on whenever I'm in store working with people. So the first step that we will talk about is cleansing. And also just to share, I love all things beauty, makeup, hair care, skincare, but skincare is truly my favorite topic. I'm a licensed esthetician, so I've been working in the beauty industry for a long time, but worked in medical spas and did a lot in the treatment room with skincare. So I love talking about this piece with people. And so with that first step, and I'm sorry if I'm looking down, what my cat is trying to jump up on my lap and make an appearance. He must know that we're live. And so he's circling my chair like a shark right now. So cleansing. It's really going to be removing any of the dirt, oil, makeup, impurities, and it's preparing the skin for any further treatment like your serum or your moisturizer so that those can truly penetrate and get into the skin and do what they're supposed to. A tip here to keep in mind when you are cleansing is that warm water should be used because this is going to be a lot less drying and irritating to skin that is already sensitive. Hot water is going to possibly cause itching for some individuals with certain types of cancers. And ideally, cleansers should easily wipe off to avoid any skin irritation. So creamy, mild cleansers are usually best. You do want to avoid
Greta, we can't hear you. Greta. Oh, we've got a bit of a technical difficulty here.
Greta?
Does anybody have Greta's number to text her?
Let's try to type something in the chat box.
Yeah,
and see.
that's I'm doing that now. Yeah.
Okay. Okay.
I'm just doing it directly to her. I don't know if she sees it. Nope, I don't think she sees it. Anybody have Greta's number? Well,
I think I might. I'll look through my emails here real quick.
okay. Maybe if I put a sign up here, let me see if I can find a pen. Greta, can you hear me? Hmm.
I have her number. I'm texting her right now.
Okay, thanks. These things happen. She's keeping going. Maybe even try calling her. Yeah, she can't see my chat, that's for sure. We're gonna have to have her go back for a while.
Kelly, can you stop the screen share? Would that mess things up too much?
You know what? It wouldn't hurt to try. So I'm gonna make myself, oh, she's gone completely now.
Uh-oh.
Yeah, she's gone.
I just
I'm-
texted her and I called her too, so we'll see what happens.
I'm wondering if
Oh, there
she's,
she is. Oh, you're on mute, Greta. Still on mute.
Greta, or
Greta, we can't hear you.
Am I back on? Did I get kicked
There
off?
we go.
You're
been
back.
off
Okay.
for about
You-
a good
you-
solid
Alright.
5 minutes.
Yeah, you kept going. We couldn't hear you for a while. You started going through products and we're like, nope, nope.
Oh man. Okay. Where did I leave off last?
Right
I'm gonna-
after Tom, really.
Oh no, I told you all of the secrets to have the perfect skin and all of the secret anti-aging tips. All right. So right after Tom, all right, let me go ahead and share my screen again here.
These are the things that happen with virtual
Yep,
programs sometimes.
Patience with technology is one of the biggest things that I have learned. Can you see my presentation now? Does that look right?
We see what you see with the next
Okay.
slide and the notes.
All right, let me go ahead and escape out of here.
Now it's
So,
just you.
all right. I'm gonna just pull up my regular deck. And then I'll get this back into presentation. All right.
Perfect.
Let's try this again. So did you hear me talk about cleansers at all?
A little bit about cleansers, just a little.
Okay. All right. So
I think the last thing you said was like something about like creamy cleansers.
creamy cleansers. Okay. All right. So did you hear me talk about the cleanser that comes in the kit?
No.
Okay. So there is a cleanser that comes in your kit if you received the La Roche-Posay kit, which is a dermatological skincare brand that we partnered with to create this collection of skincare products. And this is really nice because it kind of gives you a little bit of everything to sample. And then there's even a coupon in here. It's a $3 coupon that you can use if you were to try something and love it. You can come in and get a full size. And the cleanser that comes in here is the Hydrating Gentle Cleanser. So this is one of my personal favorites. It is great for all skin types. You can use it, especially for normal to dry skin types because it is hydrating. It's pretty potent, so you don't need much. A little bit is really going to work for, I would say maybe like a dime to nickel size will be plenty to cleanse your entire face with. So with this, you're going to just gently massage it into the skin and then rinse thoroughly after. And I don't know if I probably already talked about using the lukewarm water instead of hot water. So now we'll go into moisturizers and oils. I'm just laughing because I don't know if my camera was still on and I was probably animated and
it was, but it happens to all of us. We do have a question really quick.
Yeah.
Are they paraben free?
So most are, let me see if there's any, so they're all allergy tested, tested on sensitive skin and fragrance free. Let me double check because most things are nowadays. I can go ahead and would you be able to, can we come back to that? Can we put that maybe in a parking lot and then I can come back to that? Just to, I want to be sure to verify. I would imagine yes, but I always like to, ensure that I'm getting the correct information. And a lot of the information is right on here. Usually that would be posted. So I'll come back to that one, but great question. And a lot of things, especially in this partnership, they did clinical testing on these. Our Walgreens clinical team really worked to ensure that these are safe products. And of course, you can always partner with your doctor too, to see what kind of suggestions that they have. So moving into moisturizers and oils. So moisturizer is your friend. This is going to be your secret weapon to combat dryness and irritation before it happens, and of course, when it happens. And there's no set rule on how often you can use a moisturizer. This can be applied as needed to hydrate your skin. I typically use my moisturizer in the morning and in the evening after I've cleansed my skin. Of course, this can go for the entire body, but I'm typically right now, I'm really kind of talking about facial skincare. And you definitely want to make sure that you have sunscreen in it. Sunscreen is a must. And this is, we suggest using at least an SPF of 30 or higher. If it's not included in your moisturizer, then you would want to apply it after your moisturizer. So this is kind of the example here of, let me go back one. So if you have a medicated cream, then you would apply your moisturizer, your sunscreen, and then cosmetics. And I'm just gonna check I see that I have gotten a text here. I wanna make sure that you guys can hear my audio. Okay, this was from a little bit back. All right.
We
perfect. Now
can
I
still
have my-
hear you.
Okay, I have my phone by me now, so if I cut out, then I have it right next door. So one of the tips here, like I was just saying, is I'm talking about a lot of facial skincare, but of course with some oils, these can not only be used on the face, but they're great for those extra dry patches like our elbows, our knees. I like to use it on my cuticles. So we have some oils that are fantastic multitaskers. And then just general dryness. I mean, there's topical and internal hydration, and they're both important to keeping our skin moisturized. So with our topical hydration, that would be creams and ointments. And creams and ointments are going to be a better choice than maybe a lotion because they're typically thicker and going to help retain that moisture. And then for internal hydration, drinking 8 to 12 glasses of water a day. We already talked about using alcohol-free products because this can cause dryness, irritation, and breakouts. So again, another thing in your kit is the Cicaplast Balm. It's an amazing multitasking product. So this is going to be something that can be used. It's a multi-purpose balm, and it can actually be applied to the body, the face, and the lips to soothe any dry skin irritations. I have had, I mean, just, a scratch or different things that I've wanted to make sure that I've healed quickly. And this is amazing. So this is something, that people will use for all over. And then moving into the eye area, this is another favorite topic of mine. So with skincare and eyes, you always want to make sure that you're using products that are specifically for the eye area. So the skin in the eye area is way thinner than the rest of the skin on our face. I've heard some analogies before where people have said that the skin under our eyes is almost like tissue paper. So it's very thin and delicate. And then the skin on our face is sort of like a printer paper, just like a regular sheet of paper. And then the skin on our body would almost be like construction paper, so a little bit thicker. So when we're applying our eye products, you always want to just gently pat it into that orbital area. And so I have my light up mirror here and one of my favorite eye products. So this is the Mineral 89 from Vichy. It's actually a sister company to La Roche-Posay. And I'm going to show you what I do. I usually just use like the size of a rice grain is honestly enough. So this is just a very small amount. And you want to use your ring finger to just pat this into that orbital area. So if you feel on your, I'm going to use my pinky here first, around your, let me get this lit up. So around your eye area, that orbital bone right there, this you can is the area that you want to apply the eye product because it's going to travel up where it needs to. And same with if you're applying it up here, it'll travel down where it needs to. So there's no need to get it all the way up in the lash line. I always say it's not eyeball cream. So you're going to want to apply your eye cream with your ring finger, and you can just gently pat that. I usually kind of do more of like a sweeping out motion when I'm applying that. So using that ring finger, I brought in another finger too, because I'm actually applying this over my makeup and wanted to make sure that was evenly dispersed. But you always want to apply products like that before your makeup or concealer, because that's going to keep that very delicate skin hydrated and help those other things to go on nice and smooth. And then going back to touch on sun care a little bit more. I was talking about how sun care is one of my favorite topics. And right now we are in that season where we're getting into some warmer weather and, people are spending a little bit more time outside. And most anti-cancer medications and radiation therapy increase sensitivity to the sun. So it's very important, as I mentioned earlier, to incorporate a sunscreen of SPF 30 or higher in the daily skincare routine. Of course, you want to avoid tanning booths. And then if you can wear some protective clothing too, then that can be helpful even on cloudy days. So there's something that we say with if the sun is out, it's coming through the clouds. And even when we're inside, so if I'm working inside for most of the day, there are windows, I'm driving in my car, and I like to share, if you can see the sun, then the sun can see you. So we always need that sun protection. And there are different types of sunscreen. So there are chemical sunscreens, and these usually go on first. These are actually going to absorb the sun rays, and they go on first typically because they need some time to dry and set. And then there are mineral sunscreens, which are going to deflect the sun rays. So in your kit, you have from La Roche-Posay, the Anthelios SPF 50. This is a mineral sunscreen. And this is going to be a super lightweight texture. It has a pretty matte-like finish, so it's not going to give you a really shiny look. And you would want to apply this generously about 15 minutes before going out into the sun. And it's always nice to just shake well before you use it, since this one is a mineral one with a little bit of a tint. For the face, when you are applying your sunscreen, you actually want to use about the size of a nickel. And to ensure that you have some even coverage, you can dot it directly on the face and rub it in instead of just squeezing a large amount right onto the hands and then applying it. So this one, like I said, it has a little bit of a tint. I'm going to go ahead and put some on my hand. I love this one. And I usually in the summer, if I'm active outside, I don't wear much makeup. And this actually gives me a little bit of coverage. So you can see when I put it on here, there is some color, and I'm just going to work that into my hand. And you can see if I go side by side, this actually, it does give just a little bit of color. Something to keep in mind with sunscreen that I always share is that when you are applying sunscreen, let's say you were wearing this with maybe a foundation that has some SPF or a moisturizer underneath that has some SPF, the numbers do not add up. So if I have a foundation that has an SPF of 20, and then I put on my mineral SPF 50, that does not mean that I have an SPF 70 now. So they don't add up. It would just be whichever one is the highest. I still would only have that SPF 50. So that's always something that is news to a few individuals. And when it comes to the body, this is another favorite demo of mine. You actually need about the size of a shot glass when you're using your sunscreen for your body. So I know it's kind of, well, we're in about happy hour time. We're not going to do actual shots of alcohol or anything, but I'm going to show you with the shot glass how much sunscreen you would actually need, because this is something that every time I do this demonstration, people are just blown away with how much sunscreen you actually need to truly protect your body. So that seems like a lot, what I just squeezed out. That would be what a lot of people would probably be spreading onto the body. This is. So I'm still going. And this would be about 2 tablespoons. I'm getting towards the end here. All right, so that would be the amount that most people actually need to protect their entire body. So with that, you know, it's good to keep in mind that not just in these warmer months, but really all year round, no matter where you live, we need that sun protection. And then that is kind of wrapping up the skincare section. We're going to move into the makeup portion now and kick it off with brows, which is always a hot topic. Everyone always wants to know, you know, techniques on how to draw their eyebrows on, or, you know, make their brows look a little fuller. And with, you know, if you're losing some of your eyebrows during treatment, this can really help frame your face. I am naturally, my skin and hair are pretty light. And so if I don't have my eyebrows on, then I definitely don't have, you know, as much definition. So this is one of my favorite things to show people. And you can see there's some little tips on there for when you are drawing them. And I have mine kind of lightly drawn on. I had some other things. I was working earlier and I almost thought that I would have some time to kind of take them off, but they're not fully drawn on right now. So I'm going to do a little demo for you here. I'm going to get my mirror back out. So with this, you can see you're going to start by aligning your pencil with the nostril and the inner corner of the eye. So this is where I am going to start. I want to make sure that you can see. So right there is where I would want my eyebrow to start. And you can even put a little dot there if you wanted to. And so that's where, I did an okay job where I started, because mine do not come over this far actually. And then for the highest point, that would be if I take the pencil, the brow pencil, and I line it with the, I'm going to hold it in that same place in the nostril on the outer portion of the pupil. So you can see in that picture, that's where, let's see, right about here for me. So that's where I could then put another, you know, little dot up here. And then for the tail, the end of the brow, that's where I'm going to take the pencil again on the nostril, and then I'm going to move it over to the outer corner of my eye. So my eye ends right there. So my tail is not long enough, you can see. So then I can bring, let's see, that end, right? I'm not too far off. So I'm going to put a little dot right there. And then what I do is I do very, you know, short, feathery, small strokes. This is a nice skinny pencil. This is Physician's Formula that we sell. And I just do some small, feathery little strokes like that. And then I can kind of, you know, connect those dots. Here you can see on this side, I did not fill in as much. So I'm just going to use, what I like about the skinnier pencils is that then it's easier to mimic the brow hair with those short little strokes. And then a lot of brow pencils have this little spoolie on the end that you can kind of comb through the brow to blend. So this one could probably use a little more blending here. And it can also be used if you make any mistakes, it can almost kind of just clean up the edges here too. So that is, one of the best things to do with brows when you are drawing them on is using that general brow mapping tool by lining the pencil up to the inner corner, the outside of the pupil, and then the outer corner of the eye. And they're never going to be perfect. They are sisters, not twins. I mean, I've been doing my eyebrows for a long time. Some days are easier than others. Practice makes perfect. Some days they're not even sisters. Some days I think they're distant cousins. But it definitely does help to frame the face. And another thing too that people often ask about is lashes. So mascara is going to be one of those things that can help restore the look of a lush lash is if it is thinning. Some tips here are that, I will talk with people that say, oh, it's so hard for me to take my makeup off at night, but removing all of your mascara completely at night is that is critical because the eye area is so delicate and you want to use a gentle eye makeup remover when you're doing that, and that will help keep the health of your lashes at its best. And you also want to avoid introducing any bacteria into your mascara tube. So when you are using your mascara tube, you want to gently twist it around the wand when you're moving it around in the container if you're trying to get more product on the wand rather than pumping air into the tube. And one tip that people always enjoy hearing here that is something to keep in mind is that it's suggested to purchase a new tube of mascara when treatment begins, and then again every 2 to 3 months. So every 3 months is kind of that general rule of thumb when it comes to mascara because the eye area is so sensitive and we definitely don't want to introduce any bacteria there. And then false eyelashes and lash nourishing products are not recommended during treatment as they can cause eye irritation. With eyeshadow, so I don't know how many people here will actually use eyeshadow, but I love eyeshadow. I think it can really help to brighten the eyes. And when it comes to applying the colors, I'm going to show you, I actually have some, I got some of my products out just for demos. The lightest shade, so this is going to be your highlighter. And this is going to be applied just below the brow arch. So I get a lot of questions, especially now that palettes have become so popular. So this is one of my favorite palettes. I don't have the one, it's in my other bathroom on a different floor that I didn't grab on time, but I'm going to show you with the lightest shade here. So the highlighter is going to go just below the brow arch. So here, let me get my light going again. So I'm going to apply that just below the brow arch. And then for the lid color, which would be the primary color, that can be swept right across the entire lid. And I like to do, for me, kind of just like a medium tone. So we could do something like this in the top corner, or I actually have on this kind of light shimmery color here. So I'm just going to apply that right over the lid. And then to contour just the natural shape of the eye, that's when I'm going to use a deeper shade and put that just right in the crease. And that's just going to accentuate the eye's natural shape. So for me, I am doing kind of more neutral colors. Of course, you can do more bold. Well, this is neutral for me and for a lot of other beauty lovers. But for some people, this could be a bold look. And that is, it's all in the eye of the beholder. So whatever, some people would never wear eyeshadow, but it is a common question on, where to apply what. So I'm going to use actually just this lighter shade over here and apply a little bit just right in to contour in the crease of the eye. And I already had some on, I'm just kind of, that was from earlier. So that would be your eyeshadow. You definitely, a good rule of thumb, when in doubt, blend it out. You can never blend your eyeshadow too much. So another thing, as we were talking about with mascara and how you may not have that full lash look that you would like. Eyeliner can actually be used to recreate the look of full lashes, and it can define that lash line and recreate, you know, that that emphasis around the eyes that you might be looking for. And this can be done with either a pencil or a liquid eyeliner. So it can be done along the upper and lower eyelids. And just a note here that liquid eyeliner can be more difficult to apply for a lot of people. So, you know, practice makes perfect. Even for myself, who does makeup every day, liquid eyeliner is, you know, that can still be a challenge for me at times. So pencil is typically what I suggest. And I like maybe a soft brown or a soft gray. And you can even kind of just dot that right along the lash line and just blend it to kind of create that look of the full lashes. And foundation. So this is a big one that I usually get questions on too. So when the skin texture is changing or it has discoloration, primers can be used to help make the surface of the skin more smooth before applying your foundation. And then there are some primers that can actually help with the tone. And with cancer treatment, this can cause light skin to redden and dark skin to darken, but the foundation can help disguise these changes if you are wanting to even out that tone. So if you're using a primer, which I use the analogy of kind of like when you're painting a wall and you're using a primer first before putting the paint on, the primer is going to help that paint to just go on really nice and smooth. And you typically don't need as much. It's going to help it stay on longer. And then you can always do a concealer. And if you like just sheer coverage, you can do tinted moisturizer, or you can do a foundation. So there are all different coverage types. And this is where the beauty consultant can really come in and be that expert, giving you some suggestions. So if you like a sheer coverage, we definitely have options for those, you know, tinted moisturizers, or if you like more of a medium to full coverage, then, you know, we have a ton of those too, and some with SPF protection as well. And then concealer. So we just touched on this, that it can help with discoloration. It can help hide dark circles under the eyes, blemishes. And if you're having extreme discoloration, you can actually use a color correcting concealer. So you can see some of these shown here for any redness in the skin. Sometimes a green corrector will be used to neutralize that. For any sunspots or hyperpigmentation, those brown tones that are darker than the rest of our skin that we want to even out, then that is when you would use a yellow corrector. And then for darkened skin that we, you know, maybe it's looking kind of dull and we want to brighten it up, that's when we would use a lilac corrector. And I know it seems kind of crazy when you see these at first, but they actually blend into the skin quite nicely. And then you can follow up, you know, with your other products after that. And then for lips, so lip color is going to kind of create that balance between the eyes and your lower face. This lip color is really all about, you know, what you like. So for me, I typically like more neutral colors. And the suggestion here, if your lips are feeling drier, that a creamy hydrating lipstick can definitely feel nice going on. I actually, right now, I have on the Neutrogena Hydro Boost. This is their hydrating lip shine. It leaves your lips feeling hydrated for up to 24 hours, and it has hyaluronic acid in there to do that. So this is my favorite one. I'm wearing the pink mocha. So I love this because I can eat and drink and talk, and it just kind of fades naturally. But if you are wanting to find something that is kind of just natural, you can use a lip liner that's actually close to your natural lip color to line the lips first, and then fill in the rest of the lip area. And then you can apply your lipstick on top of the liner. And then for cheeks, so this is our last thing with cosmetics. This is going to give that pop of color under the eye. I always love putting on a blush when I'm doing someone's makeup, because when we put on a foundation, everything is then evenly blended, but we're not used to, without makeup on, we don't have just all one color. We're used to seeing different colors in our skin. So this kind of helps tie in your eye and lip color. And this is another one where a lot of people will ask, how do I apply it? And I usually like to just apply it right to the apple of the cheek. So that's going to be like when you smile, this nice rounded portion right here. And there's so many different formulations of blush now. There are creams, powders, crayons, sticks. I really love cream blushes. And the color can just be dependent on your skin tone, what you like. And you can use a brush. If it's a cream blush, then I will sometimes just even use my finger or a sponge. And then our last topic here is nails. So chemotherapy can sometimes cause changes in nails and nail beds. For instance, the nails are more brittle, they can break more easily, they might have grooves, change color, be more sensitive, grow at a faster or slower rate. The nail beds may also lift up. And the suggestion here is to keep nails trimmed and short if any of these changes do happen. And the nail changes almost always go away after treatment ends. So the other general nail tips here, other than keeping them trimmed, are to avoid manicures and pedicures, particularly while undergoing chemotherapy, because the equipment that's used in the beauty salons may lead to infection. There are so many wonderful things that you can do at home now, especially over the last year when we all were learning how to do, DIY, the do-it-yourself beauty things. I know I was doing a lot of at-home manicures and pedicures. And so another thing that you can do is use cuticle cream to help prevent any dryness, splitting, hangnails, avoid cutting your cuticles. You can wear gloves to minimize any damage or prevent infection, especially when you're washing dishes, cleaning the house, gardening. And then using hand and foot creams or moisturizers regularly. Obviously, keeping that area hydrated will help keep that barrier strong. And then avoiding fake nails, nail wraps, or gel polishes, because those can increase infection by actually trapping bacteria under that fake nail. And then for color changes, so if the nails have not split, you can disguise color changes with nail polish. But again, the suggestion is to not use false nails and to use a water-based polish instead of a conventional nail polish to avoid possible toxicity. Use a polish remover that does not contain acetone, ethyl acetate, or other harsh solvents. And if you do have nail pain or infection, then you definitely want to speak with your pharmacist or your doctor for consultation there. All right, so this is our last piece with the skincare and cosmetics. And these are just some general hygiene tips for at home. You always want to apply, and some of them might seem like, you know, a no-brainer, but these are important because people, you know, any individuals with cancer are at a higher risk of infection due to treatment. And so we want to reduce the chances of spreading bacteria and infection. So you always want to wash your hands thoroughly before applying any cosmetics. You never want to share any cosmetic applicators. You want to use clean fingers or even disposable applicators such as cotton balls or sponges, cotton swabs to apply any lotions or creams. Use clean brushes. So it's really important to clean your brushes regularly, any of your cosmetic brushes. And close your makeup containers tightly after use to make sure no air or other, you know, airborne things get in there. We talked about replacing makeup, especially eye makeup. For mascara, we talked about every 2 to 3 months. And oftentimes it'll say right on the package, you know, after it's been opened that, you know, maybe it needs to be replaced after 12 months. And then if you're trying something new and your skin is feeling sensitized, it's good to do a test patch. So you can do that right on your wrist or, you know, maybe on the jawline of your face or somewhere else to see how your skin reacts to a new product. And then again, be sure to talk with your pharmacist or your doctors about any potential adverse reactions to cosmetic or drug products. So that is it for our cosmetics and skincare portion. We do have some tools and tips with the different things that we have on walgreens.com that I can go into, but we can definitely open it up for any questions right now on anything that I have
So
covered.
I'm just, sorry, Greta, I'm just checking the Facebook to make sure there aren't any comments there. And I don't
Okay.
see any comments or questions on here. So my thought is, if it's okay with you, that we'll end the Facebook Live so we can kind of get
Sure.
a little bit more personal with those of us on Zoom. So I'm just going to really quick add myself spotlight here. Well, thank you on Facebook, anybody watching. And if you have any questions, you can visit our website or give us a call at 563-326-7504. Thanks so much.